The core of neurodevelopmental care is providing babies with an extrauterine experience that closely mirrors the intrauterine environment. When utilizing Dandelion products to promote neurodevelopmental care, these 5 goals remain constant. We strive to achieve physiologic flexion, promote containment, keep extremities in midline, allow for free movement and recoil, and provide 360-degree proprioceptive input. Appropriate supportive positioning enhances physiologic and behavioral tolerance of NICU interventions, decreases stress, and supports the developing brain of the infant. The flex position in utero is the foundation for all future movement, yet difficult to achieve outside the womb. The DandleROO2 provides 360-degree support to the infant, allowing the baby to move, stretch, and return to the contained flexed and midline position. This support plays a crucial role in early development of the nervous system. To use the DandleROO2 in a supine position, first, open DandleROO2 completely. If desired, a gel pillow can be laid flat inside the DandleROO2 if additional support is needed or skin breakdown is a concern. Place baby in the DandleROO2 with the head touching the head roll. Gently hold baby's hands in midline and pull first on the short wing over the chest and arms, ensuring shoulders are rounded forward. Wrap the longer wing over the shorter wing and attach the Velcro to the back of the positioner. If the DandleROO2 is the correct size, the Velcro square on the front of the wing will land in the center of the baby's chest. The wing should form a V under the baby's chin in order to ensure the airway remains uncovered while the baby is fully wrapped. Round the baby's lower back into posterior pelvic tilt by bending the knees at a 90-degree angle and tucking them into the abdomen. Maintain flexion in that position using the multi-purpose roll by placing it against the baby's hips and thighs, as though the baby was sitting in a swing. Firmly secure the multi-purpose roll to the back of the positioner using the Velcro tabs. Keeping the baby's legs flexed, pull up the pouch around the baby and attach the center strip to the center Velcro square first, then the side strips to the Velcro on the back. The head roll can be folded down as needed to accommodate medical equipment. For the prone positioning, you start by opening the DandleROO2 completely. If desired, a gel pillow can be placed inside the DandleROO2 to use as a prone roll. The gel pillow supports rounding of the shoulders and adds support for maintaining flexion with the multi-purpose roll. The gel pillow should lay between the nipples to allow shoulders to drop. The end of the gel pillow should be tucked in to land just below the umbilicus, allowing for hips to be flexed. For smaller babies, the multi-purpose roll can be placed underneath the positioner or directly underneath the baby and used as a prone roll, following the same guidelines for roll placement. In this case, the gel pillow can be placed inside the positioner and perpendicular to the roll in order to support the head in the same plane as the body. Next, place the infant prone inside the positioner with the head touching the head roll. Round the baby's lower back into posterior pelvic tilt by bending the knees at a 90-degree angle and tucking them towards the abdomen. Maintain flexion in that position, using the multi-purpose roll by placing it against the baby's hips and thighs, as though the baby was sitting in a swing. Firmly secure the multi-purpose roll to the back of the positioner using the Velcro tabs. Bring the shorter wing around the baby's back to support rounded shoulders and hands towards midline. Wrap the longer wing over the shorter wing and attach with Velcro to the back of the positioner. Fold down the side of the head roll the baby is facing to prevent the baby from breathing into it. Keeping the baby's legs flexed, pull up the pouch around the baby and attach to the wings and the back. A properly sized DandleROO2 will fit easily around a baby who is resting in a flexed posture, but may appear too small if the baby's legs are extended. For babies in a side-lying position, use the same principles as when placing prone or supine. Ensure the baby's back is supported in a C curve while maintaining alignment with the head and neck, keeping the knees and hips flexed. sideline may not require use of the multi-purpose roll, although some find it may be beneficial to use the multi-purpose roll to help the legs maintain flexion or lay it behind the baby for an additional positioning support. The DandleROO2 is the ideal positioner for preterm and smaller babies in the NICU. The design of the ROO2 allows almost fully customizable positioning support, allowing NICU care providers to meet the unique medical and neurodevelopmental needs of infants across NICU levels of care. For information on customizing the DandleROO2 to meet medical care needs such as respiratory support, phototherapy, or IV access, please see the DandleROO2 modifications video.